Hello, my name is Lori. I will be your nurse today. I will be conducting a cranial nerve assessment on you, which consists of testing the 12 cranial nerves. Cranial nerve 1 is the olfactory nerve. It tests your sense of smell, and we will not be testing that nerve today. Cranial nerve 2 is the optic nerve. We would use a Snellen chart to test your vision. With that chart, we would ask you to stand 20 feet away from the chart, cover up your right eye, and read the lowest line that you can read. A normal vision is 20/20, which means the first number means the distance from the chart, and the second number is the normal vision that the normal eye can read at that distance. We would repeat that test, testing your left eye and then both your eyes. If you miss 3 or more on a given line, you are considered failing that line, and we move on to the next line. The other part of testing this cranial nerve is confrontation. So I'm going to ask you to cover your eye with this index card, and I'm going to move on this side and look straight ahead, and you tell me when you can see my fingers move into vision. Say no.
No.
We'll go again.
No. No.
It's supposed to be more funny.
No.
Okay, I'm going to switch eyes, and I will move over here, but I don't want to block you. That's the problem.
No. No. No.
Cranial nerve 2 is intact. The next nerve is cranial 3. Cranial nerve 3, the ocular nerve. Ocular motor. So it's testing your movement of your eyes. So follow my finger with your eyes, not your head. Look straight ahead at my finger. This test, we're looking at his eyes moving downward and inward as the finger comes close to him. There is no nystagmus present. Now I am going to check his pupillary response by shining a light in his eyes. Just look straight ahead. His pupils are equal, round, reactive to light. Cranial nerve 3 is intact. Cranial nerve 4 is accommodate. Which we're going to follow the light. We're looking for the inward downward motion again with the eyes. Cranial nerve 4 is intact as his pupils accommodated. Cranial nerve 4 is also called the trochlea nerve. Cranial nerve 5 is the trigeminal nerve. I'm going to ask you to try to open your mouth against resistance and close it. We would test sensory in this nerve with a cotton ball on his face, scalp, cornea. Cranial nerve 5 is intact. Cranial nerve 6 is the abducens nerve. That was tested along with cranial nerve 3 with the EOM. Cranial nerve 6 is intact. Cranial nerve 7 is the facial nerve. Please act like you're chewing. Close both your eyes. State your name
Brian,
and your date of birth.
11/25/1997.
You don't have to keep chewing. Smile, frown, and puff out your cheeks with air. Taste would be tested with this nerve as well, but we are not going to test that today. Also would test for tears and salivation, but we are not testing those either today. So cranial nerve 7 is intact. Cranial nerve 8, the acoustic nerve. I'm going to plug your ear and whisper something to you, and please repeat what I said to you.
Whisper.
And we go to your other side and do that ear.
Baseball.
Hearing is intact bilaterally. Equilibrium would be tested with this, but that will be tested when we do the head to toe assessment with the gait. Cranial nerve 8 is intact. Cranial nerve 9 is the glossopharyngeal nerve. Please say ah. I would also check for his gag reflex, but I'm not going to stick something in your mouth.
Thanks.
Cranial nerve 9 is intact. Cranial nerve 10 is the vagus nerve. Please state your name
Ryan,
and your date of birth.
11/25/1987.
There's no hoarseness with his verbalization. Please swallow. No issues with his swallow. Cranial nerve 9 is intact. Cranial nerve 10 is the vagus nerve. Oh wait, we just did 10, sorry. Cranial nerve 10 is intact. Cranial nerve 11 is the spinal accessory nerve. Move your head side to side. Okay, now nod. And shrug your shoulders. Cranial nerve 11 is intact. Cranial nerve 12 is the hypoglossal nerve. Please stick out your tongue, looking for midline position of the tongue. And now move your tongue side to side. And cranial nerve 12 is intact. Thank you for helping me out.
You're welcome.